This is Moving Mad in Medicine, hosted by Monel.
Hi, I am Monel, a doctor trying to make sense of medicine without losing myself in the process. And this is Moving Mad in Medicine, a podcast about working in a system that demands excellence, but rarely offers softness. Here we talk about the pressure, the ambition, the doubt, the quiet anger, the chaos, the relationships, and the questions we are not trained to ask out loud. This podcast is honest and reflective. Sometimes it is funny, and other times it is uncomfortable. If you're in medicine and you've ever thought of leaving it or reshaping it, or maybe just surviving it, come with me and let's talk. Guys, this episode may have some distorted sound up until the 5th minute, so please bear with me and have fun. Thank you for listening. Bye. Hello, I am very excited for this episode because we have a guest on the show. I know people love to have guests on the show, and this is a friend of mine and a colleague. I will leave her to introduce herself. So here you go. Hi everyone, I'm Osafanmen. I'm a medical doctor in my first year of practice. I am very excited to be here. It's my first time on a podcast. Thank you so much for having me. I can't wait to share my experiences. Today we are going to be talking about the different types of patients you encounter in clinical practice. In clinical practice, you always encounter like different kinds of patients. The ones that are the good, the bad, the ugly, the annoying, the sweet, and whatnot. The different kinds of patients every day. Every day is another story. The thing is, nobody talks about those kind of things. In morning reviews, you're hearing stuff like, she's a 23-year-old, gravida 1, paradise, those kind of things. And nobody ever asked you if that woman threatened to slap you last night. It's not a part of morning review. So we're going to be talking about the personalities of the patients outside of their diagnosis and their treatment plans. The kinds of patients that we encounter on a daily. Okay. Yeah, so we're going to be starting with the sweet patients. Those ones are my favorite. Why not? So do you often encounter sweet patients? Oh yes, I do. I've actually encountered quite a number of sweet patients. In fact, they actually make me remember why it is we do what we do. I've had patients that'll come to tell me, okay, you're still working. How are you doing? There was a day I was in the clinic. There was a patient that came. And for the very first time, a patient asked me, okay, how are you? I almost called that woman that day. They're the first person that's asking me this question. That's so sweet.
Yes.
She's really sweet. She's really sweet because they're always coming to complain about one thing or the other. This is the first time I actually paused to ask me, okay, how are you doing? I said, you're the first person that's asking me this question. She was like, I understand.
Aww.
How are you? I said, I'm fine. She said, hope you are resting well. People should take it easy. I was very surprised.
That's so nice.
Yes. I've had a couple of other patients like that. And then there are some of them that may want to give you cash gifts just for attending to them nicely. Like you've not even done anything yet to just your manner of approach. I see you must be very polite.
I am.
Trust me, I am. That's nice. What have you? Yeah, sure. I've encountered a couple of sweet patients, right? They are the ones who are just genuinely kind. I like to think that's their personality. Yeah. But I think the sweetest patients I encountered were in obstetrics and gynecology, especially those that just had children. Yeah, they're usually very excited. Because I was in the IVF team for the longest. So those people who have they go through that whole process of wanting a child, and they eventually get a child. Yeah. And then you look out for them, and the next moment they're inviting you for their naming ceremony, or they want to get you a drink, or they want to give you a gift. It's usually very nice. It's a beautiful experience to encounter sweet patients. Some patients are really just sweet. Yeah, they are. Yeah, they are. And it's a nice thing. Or the ones you see outside of work. Yeah, and then they recognize you and they're treating you so nicely because they remember what you've done for them. And you've probably forgotten them. But they're just being so sweet. So yes, it's a nice thing, right? Yeah. The next kind of patients are the patients that always have a marriage deal. Yes, there's always that patient, that woman. In fact,
Yes.
a young person has told me that you would like my brother, would you like it? So I like, what? How? Why are they always hawking their brothers?
I don't know.
Is there something I'm missing? I don't know. Yeah, there are patients like that. They're like, you like my brother. My brother, he always want to marry a doctor.
Exactly.
He has done his master. He's doing his PhD now.
And they also want to collect your contact just in case.
Yep. They always have a marriage deal. They always wanted to have a daughter-in-law who is a doctor. Exactly. Someone that will take care of them and all that stuff. I don't know. Those kind of patients. I think everybody has encountered such patients.
Yes.
Yeah.
Very much, yes. Like a lot of them, they'll say, oh, Doki, and there's this my brother. You already know where they are going to. Is this my brother? And when they start asking you about your tribe and all of that, and they start asking you about your phone number, and then you see mothers of patients, they'll be like, there's my son in the US. You would love to. Doki. You know, initially, actually those patients that they'll start calling you nurse, 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 nurse. Oh, so, I'm not a nurse, and then you now tell them, oh, I'm a doctor.
A jackpot.
Young doctor, wow, that's very nice, very impressive. The doctor, wow. You get this, my picky. You already know where they are going to.
Okay, that brings us to the third type of patients. There's always that patient that wants you to talk to somebody over the phone.
Yeah.
I've had to talk to patients over the phone, a couple of patients' relatives actually, over the phone. But well, it may be annoying because they're yanking you out of your space to talk to somebody who is not there. And more often than not, they would want you to explain what you've already explained to them.
Exactly.
But they don't understand the fact that you are my client.
Yeah.
The other person is your relative. You can explain to them. But anyway, I have had to do that a couple of times. There was this patient I genuinely had no issues doing it for because I think he was a traveler and he was involved in an accident, and obviously he had family elsewhere, some states away. Then the only person who was with him got in contact with his child. And yeah, for a good number of times, after like reviews and whatnot, you'd have to give them the updates over the phone.
Yeah.
So that was understandable.
Yeah.
But they're also the ones that are very annoying. Sometimes I don't blame them. There are some people who will have you want to talk to their family members or whoever their sponsor is, so that the person will believe them. And release money.
Yeah.
So I think that it can be an annoying situation sometimes, but I mean, if it's reasonable enough, I just lend them. I just oblige them. I do that once in a while, but it's not so fancy a predicament. Yeah, that's pretty much it.
Yeah, and like you mentioned, I don't blame them because I've also been in their shoes. Funny enough, there was a time when my auntie's husband was very ill, so I was trying to call them to reach out to them to know exactly what was going on, the symptoms, the medications he had taken, and they were explaining very poorly what was happening. So I couldn't really get the picture exactly, and I needed to talk to a medical professional that was there to explain exactly everything that was happening and the drugs and everything that he had given, so I understand the picture. So sometimes I cut them some slack because I've been in their shoes before, and maybe sometimes the person on the other side of the phone wants to know what is going on exactly. Maybe their family members are not explaining to them properly. Maybe they are also medical professionals and they want to know.
So what did you do with the info?
And then there are also some that they would say, oh, there's this my brother that is a doctor in the US, this, that, he wants to talk to you. And then you forget that your brother that is a doctor in the US is not seeing this patient. I am the one that is seeing this patient. You're only explaining what you can explain to him. The doctor that is there is seeing what is going on with this patient and has given his plan. Your uncle in the US is giving his own plan and then he's clashing with mine. You understand? And if you knew that your uncle was such a good, I need to carry your patient. So sometimes it can be very frustrating. But sometimes I also understand them and I cut them some slack.
Yeah, it's part of those blurry lines in medicine where you just use your discretion to decide if you are going to respond or not.
Exactly.
Know how to de-escalate the situation. You have to. So it's valid. Yeah. The fourth kind of patients that we have are the money and water patients. Good guy.
Yes, so
yeah, like what I mean by money and water patients are patients who just get it done. Fortunately for us, we are in Nigeria and we're practicing medicine here where most patients have to pay out of pocket.
Exactly.
And where many healthcare services they are not readily available, unfortunately. So even when you know what to do, sometimes your patient may not have the resources to get those things done.
Exactly.
So having patients who have money.
Yeah.
Who have money, it's usually very seamless interacting with such patients. Such patients, they eventually stay on admissions for shorter times because they get things done. They just get things done. That investigation, they don't do.
And they're usually so sweet. The ones that have the money, they're usually the sweetest. See, doctor, don't worry. Any investigation, anything, I will pay. Just remembered one patient that had an end stage cancer. I think it was prostate cancer. I can't remember which. So the family was like, anything, I will pay. Don't worry, they were ready to pay. And the patient himself, also a very nice patient, we tell him, thank you so much. Thank you. If you just come to maybe change his cannula or maybe just come to collect sample, any little thing, will tell you, thank you very much. Thank you. And we pray for you and pray for you.
Oh, that's so sweet. So apparently, it seems like the availability of funds has a role to play in your patient's personality.
To an extent, I think so. But then again, it's not really a direct relationship because I've met some money na water patients that are really sweet. And then again, I've also met some money na water patients that are so proud to act like they're Zeus.
They be like, they're the governor's auntie.
Like, please, we don't, no, you have to.
Like, do you know who I am?
Do you know who I am?
Do you know who I am?
Yeah.
Brother man, please now, do you know who I also am?
I think, like, myself no small.
Yeah, fair enough. Yes. But I still think that having money in Nigeria is a buffer. It relieves you of some level of frustration, so you don't get angry as much and you don't transfer your aggression to your health care providers. I think so.
Exactly.
Yeah.
Generally, not just in Nigeria.
Okay. You know, I've been in Nigeria all my life, so so I cannot say it from the other side. Anywho, on the list, the fifth kind of patients that we have is the obedient patients, the patients that actually follow instructions.
In quotes, the one that used to hear what.
Exactly. Yeah, the ones I say, I like to work with such patients. Like, they don't give you problem.
Yeah.
They don't give you problem. They don't give themselves problem.
Exactly. They make life easier for everyone. I remember one pediatric patient. I remember when I used to run pediatric clinic, I used to always tell the mothers that make sure you don't just pop antibiotics over the counter medication to give your child because they can develop antimicrobial resistance and stuff like that.
Yes.
So there was this mother I met, very obedient mother.
That's nice.
She brought her child and then we did a throat swab for her and then you could see all the antibiotics plus.
That's so sweet.
Only 1 hour. Like I had to commend her. Like I dropped my laptop and then I clapped for her. Yes, you are doing very well. Continues. Not just any medicine you see, you give your child. Bring your child to the hospital. Yes, I was very proud of that woman that day. I commended her.
Yeah, I respect people that actually leave the job for you to do because, I mean, I think this should take us to the ones that don't used to hear words. The sixth kind of patients.
My God.
Bro.
No. Especially if it involves children, it pains me a lot when the child is affected because of the behavior of their parents. It's very painful, especially when it causes a permanent damage.
See, sometimes, I don't know, you just kind of have to detach so you don't feel so horrible.
It's very frustrating, especially in pediatrics. No, continue.
There was a time where there was this patient who came in, so many things, sepsis, this, that, and eventually the baby was having a seizure and then they brought the child. When they brought the child, we had to do an intravenous cannulation, like baby was in shock. But that was not even the issue. The head of the baby had blended onions, blended palm oil.
I don't understand.
I'm like, you people should have just cooked soup.
Yes.
Oh, you feel like
you do pepper soup.
Yeah, like it was weird. The baby had all the kinds of symptoms. Was stooling. I really cannot say when the baby's problem started, but they did so much and things were so bad that they were doing, and it was like a 1 month plus old baby. Yeah, baby came with like a constellation of problems, but I think I still think it's a place of fear, or because some people are afraid of going to the hospital. They believe that if they go to the hospital, they'll bring them bad news. Some people, it's from a place of lack. They feel like they cannot afford healthcare, and so they try to do their own home remedies and whatnot. But some people are just stubborn.
You're just stubborn.
You are hypertensive. You come, they treat you, your blood pressure has been normalized. Oh yeah, now be taking this medication, go home. And then they come back weeks later in clinic and their blood pressure wants to scatter your sphic. And then you hear stuff like, oh, my blood pressure was normal, so I decided to stop.
Like, it doesn't make sense. Yeah. Or is it those patients that they actually have the money, they've been doing antenatal, they've been monitoring everything so well, and then it's time for them to deliver, they will go to the church. So everything they've been preaching in your antenatal class used to be a pod where they are preaching a bit words.
No, that pastor might be the way.
Hi.
That's why you're going to have that baby.
No.
I don't know why they do that. I don't know. It's a recurrent thing. You think people know better, but they keep doing it. Even educated people do it as well.
Remember the part I talked about, sorry to cut you short, about pediatrics when I said it could cause permanent damage to the child? Because I remember there was a child then, the baby's D2SB was, I think, about 12 or thereabout. And then we told this woman that, Mama, your child will need admission. We need to put your baby under photo light, so we can monitor your baby and then your baby can get better. The woman said no, that she will take her baby home and put the baby under the sun.
Okay. All right, now fair enough. I mean, lights.
We counseled this woman and counseled because, Mama, if you don't take care of this child, it could get to the brain and cause brain damage for the child. Lie. My mother-in-law say, no worry, I could put them for under sun. And then she carried this child away. She brought this child back after some days. The child was seizing already.
Oh, wow.
Child was seizing. We already had that opisthotonus position. It was bad. That's sad.
I don't know why they don't listen, Sha.
Exactly. And the fact that the child will suffer for the parents' misbehavior is the painful part.
That's the thing about pediatrics. The person suffering for the poor decision making. The child is different from the person making the decision. That's the only sad thing about pediatrics and maybe sometimes geriatrics, but it's one of those things, I guess. Well, if you're a patient out there, please listen to your doctor's instruction. Thank you. I beg. Let me even just break it down. Doctors are not excited when the hospital is full of patients, because it's work.
Exactly.
So if your doctor is actually telling you to stay, especially when if your doctor is telling you to stay, I guess you need to have to stay. Hello. Oh, anyway, we move. That brings me to the patients that always want to go home. They always want to go home. I don't know what is going on at home. You can't blame them sometimes, child. Really, yes, because I've been on admission before and the hospital is a very depressing place. And you wanted to go home, yes. You seem to be a very bad patient from what I can see. No, I didn't go home at the time. I didn't have a choice. The most interesting want to go home situation I ever saw was one night, like around, say, 11 p.m. Between that time and 1 a.m., there was a trauma case. And they were in the accident and emergency. And the guy came in pain. He was, his, what was it, his fibula or tibia? I don't know. One of it was poking out of the flesh.
Like an open fracture.
He was like, Doctor, I beg, come. That was after they sedated him. Doctor, I beg. You want to arrange this thing at your go house? Wait, I'm like, you want me to, is it biscuits? I should arrange this for you now so that you go home with your
I've arranged it at home now.
I'm like, what is happening? What's possibly happening at home between now and 8 a.m. that you cannot wait? You cannot wait. You want me to just package your hand like this so you go home? I'll be your leg. I was like, it was really, really, really crazy. I could see his bones coming out and he just wanted to go home. I don't know why patients want to go home. And for that patient, I can't really say he was not educated because he did sound like he was educated. Although he sounded like he was drunk.
Okay.
So maybe he was under the influence. I don't know. And I also do not think he was indigent. So I just couldn't for the life of me understand why he wanted to go home so bad by 1 a.m. or 2 a.m. in the morning.
Did he have relatives with him?
He had family members there. And interestingly, by daybreak, they had discharged against medical advice. So I don't know why they wanted to go home so bad. I don't know how they fared eventually. I really wish them well.
Well, for some of them, we really can't blame them. It could just be financial constraints. It's not like they will not want the best for themselves or their child or whichever person is involved. It might just be financial constraints. Because I had a patient then that had a PCV of 12, an inpatient, and then we're like, we'll have to transfuse this person and you can't go home with this PCV. Like, I beg we go house. We go take blood tonic for house. Blood tonic with a PCV of 12. This person might be going on a 4 on the way. You can't go home like this before they now finally said that they didn't have the money. So sometimes I don't blame them, but sometimes it might just be pure stubbornness. There's no other reason.
Fair enough. Some people can be stubborn, but I think the majority of Nigerian patients' problem is money, sha.
Yeah, money. And again, the hospital is not a prison, so if you want to go home, it's fine.
Yeah, say why you want to. At least the ones who tell you they don't have money,
Yeah.
you can give them alternatives.
Yeah.
But there are some who will just run away. Like, they will just pretend like they want to do something and they will never return. The last category of patients, these are the Mike Tyson patients. the ones that want to fight you.
Want to box you.
Burn down the hospital.
Because you did not answer them.
Funny enough, not always because you did not answer them. Some of them just come angry. Some of them maybe because you didn't answer them, some of them just come angry. Some of them even get angry because while you are doing a procedure, because you prescribe a medication they don't like or they can't afford, or various reasons. You just see angry people. There was this indigent. I don't know why I keep encountering indigent patients, but I think it's because I'm practicing in the trenches though. So, well, yes, there was this indigent patient I helped rally around for some supplies because they couldn't afford all of it. And then, interestingly, the relative of that patient went to get some things from outside. So I told the relative that since you do not have so much, I will try to let you know the ones I was able to rally around and get, so you can return them like with the receipts and all that, so they can give you back your money. And he was like, okay. And then I did that. Only for this man to start shouting that, is this all you are giving me to go and return? That I used the stuff he bought. I'm like, you were supposed to buy them in the first place. I'm just doing this because I understand people do not have enough. And he raised his voice, was shouting. It was a very horrible night for him because it was an emergency situation. And anyway, it's one of those situations where your patient wants to beat you. They don't want to fight you. So it's between you and God. So if you had the power, maybe you can fight. If you don't, you just stay clear. If it's mouth, you want to have to run your mouth. I don't know, but sometimes there are lots of patients who are a handful. There's even the one that's threatened to beat me when she sees me outside. What was my offense? We were trying to cannulate her child and it was difficult. Mind you, they have been in another hospital for a long time, and most of the baby's lines were like thrombosed. So she was like, she does not want us to prick her child anymore, that the child has been suffering. We're like, please, this medication when you're picking one carry, go need IV access. She said, no, now they do my picking wicked. Madam, it's not wicked. I think we're enjoying trying to get an IV access for your child. And she said she's not doing it again. I was like, okay, we'll go and document that this is what the patient wants. And that was how she started. That's how she changed it. Oh my God, it was crazy. Sometimes are we documenting? Like the sound of documentation made her agitated and flared up, started threatening everybody, took her treatment chart and was trying to, I don't know, there's so many things going on that day. Said if she sees me outside, she will blow me.
Oh my God.
Well, it's one of those things and it's exhausting for the most part of it. It is exhausting for the most part of it. You just have to implore wisdom when dealing with patients like this and remind yourself of why you are here and why you should not stoop low. So exchanging words
with them
or blows with them. There's this meme I saw. It was an Instagram reel and the guy was like, list of places I'm not going this year. Said above and beyond, over the limit. Then back and forth was my favorite. I think I don't want to go back and forth with anybody this year, and I think we should apply that to medical practice. When you see the thing is just getting so high, I beg.
You're really going through a lot.
Yeah, we're going through. I mean, are we not going through a lot? Or it's me that's going through a lot. Am I the only one? Well,
I've never had anybody threaten to blow me, so
no, you will see. Well, don't worry. Not unless as long as you're going to practice.
Well, yeah,
and maybe especially in this country,
yes, in this part
you
of
will
the
encounter
world.
somebody who everywhere.
Blow you. I think it's everywhere. I've had patients raise their voices at me, and then I let them know, you can't talk to me like that. I'm taking care of your child. You can't raise your voice at me. Do you understand? The other one was saying that he has been there since morning. This, that. I've been here since morning and I've not eaten anything all day. Why are you screaming at me? You are seeing the patient here. And then he kept shouting and shouting and shouting. I was even having a headache that day. Please.
The funny thing is, they don't understand that doctors are overworked and that we are short-staffed. Like, doctors are not enough anywhere. There's nowhere that the doctors are enough. So we're actually doing more than average doctors in other climes are doing. I mean, we're attending to more of them. Okay, I think I don't want to turn this into a ranting session.
A crash out session.
I don't want to crash out, and I don't think that this space is to garner pity, or we just want to explain the experiences that nobody talks about, and hope that there are people who experience it as well, and hope that people can maybe learn it too from it, from listening to the stories.
Yeah.
And share with your friends. I mean, for relaxation. Maybe the next episode we'll move stuff. Anyway, this brings us to the end of the episode. I'm so glad. Thank you for coming to my show.
Thank you very much for having me.
You're most welcome.
Yeah.
And I hope that we get to record more interesting episodes together. Hopefully we have you on the show another time.
Yeah, I'd love to do this again.
Yes, and thank you everyone for listening. Thank you for those who have always subscribed and shared. Please do the same. Always tweet at Moving Mad in Medicine and you'll be sure to get a response. Thank you for your feedback and we'll see you in the next episode. Bye.
Bye.